everyone, Dr. Carla here, and tonight I have with me Sara Luce, and Sara's a great friend of mine, and she is a nurse practitioner, about 4 years now as a nurse practitioner. But you know, we have something in common in that we both started our careers as registered nurse. So we've seen a lot of things, a lot of good things, a lot of bad things, and but it's taken us to where we are right now in both of our journeys. So, so tonight we're going to be talking a lot about functional medicine, and we're going to touch a lot about gut health and nutrition, how stress can affect us, because you see patients every day. You know, and they just come in with all different kinds of scenarios. But what I love about Sara is that as a nurse practitioner, seeing patients day by day, you really take the time to listen to them, find out what they need, and then provide them options. So we're going to talk about different types of options that you have, and then we're going to talk about insurance, because it's a big deal, you know.
It is.
That's a struggle for people, you know, either you have it or you don't know what's available when you do have it, what's not, what's covered, and so there's a shift happening. So we're going to talk about that too. But let's start really with, you know, we both started as an RN because we love to care for people. And you're really passionate about, like I said, providing patients with every option that they're available, but taking the time. So what made you so passionate? Like, was it one particular thing, or what, have you always just been passionate about helping people? Just kind of share your passion for being a nurse practitioner, helping.
I think as a nurse, we are very fortunate to have a wealth of experiences that really help guide and prepare us and start to kind of mold us in our practice. And for me, I've been very fortunate to experience all types of different settings and patients, and see, you know, various scenarios. And for me, that passion developed in helping people realize their best self through listening to them and appreciating what they're experiencing at that particular moment, and then helping kind of guide them down a path of getting there, realizing whatever it is that they feel like they need to be. And I think one of my favorite mentors, you know, used to say, if probably still does, if you listen to your patients long enough, they'll tell you what's wrong with them. If you listen to them long enough, they'll tell you what they need. And just through listening, and then again, just actively kind of guiding and kind of linking arms with them, patients are better equipped and more willing to walk with you in creating positive change in their health. So it was, I think its foundation was certainly in nursing, but then it continued to grow as I really sought more autonomy in my patients' care, and having the ability to be able to help create lasting decisions for them.
So true, because, you know, I remember days as a nurse, and we love and appreciate nurses and totally respect them, because they really do a lot, you know, caring for the patient. But like you pointed out, it's the listening. It's that skill of being able to not only listen, but we're watching the body language. We're watching their voice. You know, if they start to quiver when they're talking about something, let's dig a little deeper into what's going on there. But yeah, so from that background, but I think instinctively too, nurses are the type of people that are just, they're people. And we're good discerners, and we have that perception, and, you know, we're high perceivers, and we really care, and you really care. So in your practice now, you're in what we call allopathic medicine. That's just traditional medicine, where you order the lab tests, you know, like a regular doctor when you would go in. But you have an added piece, and we call it functional medicine. For those of you watching, maybe not understanding what does functional medicine mean, you know, we talk about holistic and integrative all the time, but another word is functional. So how would you describe functional medicine?
functional medicine for me, and I think
Yes.
it's different for everybody. And I think as nurses, we have a great foundation in that we are passionate at looking at the root of disease or disease, and it's important that, especially in functional medicine, that rather than treating the manifestation, you ask the question, well, why? How did you get there? What was the series of steps that led you to where you are today? Because that disease or that illness or whatever you want to call it or name it didn't just happen overnight.
Right.
It was a series of steps or a series of choices, or maybe not even choices, but how you internalize the stressors that you've dealt with and kind of how you get there. So for me, and in the space that I'm currently in, I have the ability to kind of dive into the nutritional and the allergenic component of how that creates illness. And that has just been so fascinating for me and rewarding in that I'm able to see my patients realize their health goals through some very basic changes. It's not rocket science. It's not expensive. It's just helping guide them and kind of get to the root and then change it back to where they're supposed to be. So.
Yeah, we talked about that, and that, we think about things like common things that people come to the doctor chronically for.
Absolutely.
Allergies, pain, which is usually some form of inflammation,
Sure.
even diabetes and high blood pressure, all of it. Well, I mean, the majority of it, if you think about it as a whole, it starts in the gut.
Absolutely. Absolutely.
And it is that easy. So that's the root of it. So you can go to your doctor and you have allergies. Okay, here's a prescription for Flonase or whatever, and let's put a Band-Aid over it so you don't have the symptoms anymore, but never really get to the root of the problem. And so the person stays on that until they get, it no longer works for them. So now they have to get a stronger one.
Correct.
And then they have side effects from that. So then they have to take another medication and they get a side effect from that. And it's a hamster wheel.
It's a process, yeah.
So just that one thing, if someone were told your inflammation, your allergies could be, maybe not, but oftentimes, statistically, it's in the gut. It started in the gut. And so when I say gut, that's a simple diet change.
Yeah.
So tell us some, like with gut health, how can we know, is it a seasonal allergy from the pollen?
Sure.
Or is it really coming from my gut? And what do I do about it?
Sure. So I think, again, with starting, how I like to start my appointments is, help me understand what brought you today and help me understand how we got here. And in the space that I'm in, I'm very, again, blessed that a lot of times they've been seen before they've seen me. So I can help piece kind of that story together and hear them and hear, what they're going through. And there are certain signs and symptoms diagnostically as you're examining a patient. You're looking for certain clues that kind of help piece it together. But one of my mentors says, 80 to 90% of this is history. Again, listen to your patient. Your patient's going to tell you the history that you need. So if it's an inhalant component, oftentimes you're going to see it at the entrance of the airway. So you're going to look in the nares, you're going to look in the throat, you're going to see those allergic changes, and then essentially we treat them. Now, and here in Florida, we don't have very many seasons. We have a standard season, and that's about it.
Year round.
Our pollen and dust and dander and mold tends to be more of a chronic symptom. So we see less seasonal allergy in this particular space. So that's kind of one segue. And then to the gut, to that component, I think oftentimes we forget, or maybe even we silo, how diverse gut health, gut allergy, allergen sensitivities, how diverse those symptoms can be. I've seen patients who only have vertiginous symptoms. They're spinning like a top, they've got vertigo. I've seen patients who had chronic eustachian tube dysfunction and middle ear disease on a regular basis, or maybe chronic nausea, vomiting, or weight problems, or headaches and migraines. I mean, stress, brain fog. There's so many different manifestations, and until you kind of broaden your scope to appreciate the various symptoms of food allergy, it's not until you get to that pace that you can really kind of start diving in a little bit. So when you get down to the crux of it and really start asking those questions, sometimes you can pick up on certain foods just by talking to them about their diet. There are high offenders. We know certain foods that are regularly treated with certain types of pesticides. We know that they have high inflammatory factors. We know certain foods are high inflammatory. So if you can start teasing those things out on the front end and then listen to your body.
Right.
One of the things I do a lot for my patients, again, a very cheap but also very effective treatment, is if we know what the high offenders are, take them away. Take them away for a week or two.
Right.
And then try it, reintroduce it, and let your body then be the litmus test to tell you, yes, I like it, or no, that I don't. But it's not until you take it away and allow for your body to kind of heal a little bit that you're really able to determine for yourself, because the patient has to experience it.
Yeah, exactly.
Whether or not it's appropriate for them. And then from there, we can dive into testing and all that other fun stuff.
So some of those types of foods that you were referring to, what could you name, like maybe 3 of the top?
Corn, kale, soy.
Kale is supposed to be good for you.
Kale is riddled with pesticides.
Wow.
So unfortunately, and I felt the same way, and I have, sidebar, but I was myself suffering with a lot of headache, couldn't quite figure it out. I was trying to eat all the right things that people tell me, these are the nutritious foods, we're listening to what we read, and just trying to educate myself, but I couldn't get a handle on these headaches. And it wasn't until I stumbled upon a form of blood testing with high specificity and sensitivity, so I could be confident in the results that I got, that pointed to kale as being one of my high allergens. And when I took that out, the migraines went away, the headaches went away, but I had to identify what that was first. Now, for me, it was a little bit of an allergen, but yes, chronically foods that are treated in that capacity, absolutely, you'll have high inflammatory factors. Egg is very pro-inflammatory. So yeah, dairy is a common problem in allergy. There's all kinds of...
Right. We could do a whole... We may do a whole episode just on dairy. Because I have seen so many people, like you said, chronic headaches, just constantly can't get rid of this headache on like medications, pain medications.
With their own slew of side effects.
And then eliminate dairy within like 24 hours, no headaches. Stay off the dairy, they never come back. Now, but like you said, each person, which I love that they have these specific tests that can show you exactly, and that's the functional part. So this is that extra step that, you may not know this, but a lot of this can be covered by your insurance. Some of it isn't, some is. But a lot of these tests will literally tell you exactly which foods you're sensitive to. And then and then you just start eliminating them and then modify it. So, speaking about certain tests that are covered and aren't covered, if someone were to go to their doctor and say, I want this test, what is it called? Something specific, or is there different?
Sure, there's various labs. What I find anecdotally, I'll say that a lot of the labs, and I mean no disrespect, but a lot of the labs that are readily covered by most insurance plans are not produced with the rigor to give you quality positives, or they will underreport positives. May be great for a cholesterol screening, may be great for general CBC, CMP. It'll give you the basic data about your basic metabolic state. But not as specific and in tuned as we need them to be. So it depends. I think being an educated consumer is important. I think it's important to ask those questions on the front end. As a provider, something that I'm passionate about is, I can't, if I offer you a solution that you can't afford, then it's no good to you. So we have to figure out a way in order to get you the data or the outcome that you need in the most cost-effective fashion.
What could be just
So-
eliminating, like you said, like
And we
take
do
the
that
top
first.
ones
That's
and
exactly
we just
what we do.
eliminate them. That's free.
That's
you know,
exactly what we do.
Might save you some money too. Just eliminating.
Absolutely.
Don't buy milk. Don't buy. You know.
I know,
That'd be
I know,
great.
and it does, because then they transition those dollars towards more appropriate foods. And I find we start with elimination.
Okay.
When elimination doesn't, because especially in our Americanized diet, there's so many different fillers and spices and things that are just kind of put into, especially our processed foods. It's really hard to tease that out. Kale, for instance,
Right.
mind blower for me. But we start with, basic elimination, basic things. And then if you want to go further from there, then we can.
Okay. So would you say that now, today, are most doctors open to doing these tests? Or if I went into my doctor and asked for that, would he just kind of look at me a little odd?
It depends. It depends on their particular viewpoint and how they've been trained. I will say, I have a dear friend who is now in academia, but when he was going through medical school and his residency and fellowships, nutrition was never something that was a focus of their training. And he's very honest in saying, I'm so glad that you're doing this, Sarah, because this was never something that I did. And now he's diving in, even as a retired physician, and saying, I wish we had done more of this. So it depends, and it's not that anyone's doing a disservice intentionally. It's just you preach what you've been trained to preach, or the data that you've gone after. But I think asking the question, if a test is being offered to you, tell me about the reliability of this test. True positives, true negatives. What is the cost? What's the outcome?
Right.
Are we ordering a test just because you want to know, or is there a process to that? And I think that's where functional medicine comes in.
Right. And so, I mean, we've seen a big shift here in Sarasota.
Sure.
And really, I mean, all over. I'm hearing more and more of this shift in healthcare with doctors that have a desire because maybe they're seeing it in their own health.
Yes.
I know a lot are just sick and tired of people being sick and tired, and they really, doctors.
And not having an answer.
Yeah, no answers, just Band-Aids. And a doctor becomes a doctor because they also care about people.
Sure.
So I feel like a doctor's called to be a doctor, just like a nurse is called to be a nurse, because you have that compassion for people and you want to help people heal.
Sure.
So I'm sure it's also frustrating when they can't really get to the bottom of it. But this is the way that they can. And so now I'm seeing a lot of doctors doing, what do they call it? It's like a personalized, like a concierge.
Yes.
And independently starting to see their patients outside of the system, I guess you'd call it, because they can offer them more.
Yes.
And surprisingly less expensive in the long run.
It is.
So let's kind of dive into that, because I know a lot of people watching are thinking, well, I would love it, but I don't have the money because I'm paying all of this money in my health insurance. And so that's what I'm paying for, to go to the doctor and get my prescription, or, if I get sick. And you need that, because if you break your leg, a bag of apples is not going to help you at that moment. So, so you have to have,
it's good.
You got to have both.
Sure.
So how can we have the best of both worlds?
Yes. I think it's a paradigm shift. I think, and I, can even speak to, for me personally, when we were raised, when we become adults, when we start, preparing our lives, insurance is something you have to have. You have to have the insurance. You have to have the best insurance. And I think that it's something that we get kind of accustomed to asking when we accept a new position, when we, are looking for what our family's needs are. And I think that there's a good foundation in that. However, insurance it's an insurance policy. It's a just in case. If I get sick, this is the net to catch me. Unfortunately, there's not a lot of preventative options there, and it is getting better. But I think the paradigm shift to help get to realize what you're mentioning is to scrutinize these plans, get what you need, and maybe for some folks that may mean a catastrophic plan where you're getting a plan that's going to focus on those accidentals. I fall and I break a hip. Of course, you're going to need something to support that. But maybe instead of spending thousands of dollars in premiums each year on a just-in-case safety net, you scale down a little bit and reallocate those dollars towards programs that are going to help sustain health, make you more healthful, truly prevent, not screen, but truly prevent those illnesses that we're all on the lookout for. So I think that's where we're heading. I'm hoping to see more folks kind of look at things that way, because I feel like that's truly health management, and health promotion is looking for how can I maintain my health? How can I truly prevent? Not just screening, not just making sure I have access to, whatever it may be, but utilizing that insurance as it really needs to be utilized.
Yeah, and it's really just about education, because I know you're very much love educating, educating people, and so this is just a missing piece, because I wouldn't even have known I had any other option.
Sure.
I thought you just pay your insurance and this is the one that you get.
That's
and
what all good citizens do.
I know.
Yeah.
I had no idea that there was even another option out there. So, I mean, until recently, but yeah, so you have options, and it's just getting the education and things like what we're doing right now is getting word out to people to, you have choices, you have options, and, finding that provider that will work with you.
Yes.
And for your best interest, and take the time to listen and see what you need. Because, oftentimes, and we'll just end with this, in that a lot of dis-ease, I love how you said that, it's dis-ease. So your body's out of ease. Why is it out of ease? We know that most of that is stress. Yes. Stress can be huge, but not just stress. We talked about thoughts, your thinking process. Yes. So if you're going to a doctor and you don't feel heard, or you feel like they've said something to you that made you fearful, or anxious for any reason, or you don't leave with a sense of peace, and you walk out with thoughts in your mind, then that can do more harm than good. So talk about stress, and then thoughts, and how can we, not just when we're treating patients, but me as maybe your patient, what would you say to me as my nurse practitioner, my provider, if on my way out the door, are there any last words that could give me hope as I leave?
So I think the presentation that bothers me the most when I see my patients are those that are crippled in fear or crippled in anxiety, and you see them having a physical manifestation of that internalized stress. And again, as we talked about earlier, it's not a single moment of stress. Sometimes it's a process of I've let that thought in, I've let that thought in, I've let that opinion in, I've let that word in, and I've let it marinate in my mind, and have created this, oh my gosh, how do I respond? This constant fight or flight mode that is just so toxic. And I see patients speaking dis-ease into their being because they are just speaking negatively, or allowing those things to kind of take hold and take root. Now, and I think there's a difference between being cautious and being realistic, and stating a fact objectively of this is where we are today, but this is where we're going to go. And I think it's important that, as you're working with your patients, that you pick up on that quickly. How someone is feeling, what their current state, what the feeling that you get from them, the aura when you walk in the room, of how they're going to perceive it, and carefully choose your words, and carefully choose how you speak life into them, and how important that is. So I think just from patient or not patient, just people, it's important that we truly take captive those thoughts and be aware of them, and not let them peel back our security and tease away at our confidence or tease away at our peace. Those things just don't have place in our lives, and so we have to be as vigilant as we can to stand resolute in what we allow our minds to give weight to. So I think the thing, as I'm counseling patients on all kinds of things, on the really scary disease and those that are pretty easy to treat, I think it's important in so many ways that you help that patient, that person, to just feel empowered. You are not what this label is, and you don't even have to give it a name. A lot of people want, what's my diagnosis? You don't need that. It's okay. I mean, I'll tell you if you really want to know what the medical community is.
This long of a name, can't even pronounce it anyway.
But you don't need to go home and Google it. You don't need to go home and Google it. Don't do that. It's not going to help you. Right. That's not going to help you. You don't have to give weight to it. You have power in this. You can be empowered to walk through this, or you can let it cripple you. And so you have to make that choice. And a lot of folks feel like they don't have a choice. And I feel like it's my opportunity to be able to help them walk away with tools for their tool belt for how they can be empowered to walk that out. And when that little thought comes in, to turn, make an about face, and choose to think about it differently, or choose to respond in a different pattern.
So do you teach them how to do that right in the office?
Yeah,
right
absolutely.
There,
if I see them crumbling, absolutely, because they have to walk away. Feel, and I hope and pray that they do. That it carries beyond after they leave. My door. And if I'm concerned that they may not, then I always am. Come back, call me. Send me a message on the portal. We'll talk about this. We're gonna link arms and do this together, because it can't be me being your provider. You have to be a recipient. You have to be, willing. So we try.
Oh, that's awesome. So I mean, just taking that posture. Then I'm leaving confident. I know someone's got my back. Yes. Not only got my back, but praying for me, lifting me up, speaking life into me.
Praying for your patients, praying with them if they're comfortable. All of that, and it matters so much.
Yeah, it does. It makes a difference. So I can tell you're an amazing nurse practitioner. So do really good for your patients, and so smart.
Thank
too.
You.
So much about, all of this shift that's happening. And
it's interesting.
Yeah, and I know you love to educate people too. So hope you guys enjoyed this as much as I did. And we will see you guys here back again next week on Dr. Carla. Thanks for having me, Sarah.
Thank you so much.
Thanks. Bye.